following information is presented for discussion and educational purposes only and is not intended or provided as treatment information for any specific person or behavior. If you or a loved one is having behavioral difficulties, you are encouraged to seek professional consultation as soon as possible. Ladies and gentlemen, welcome to episode 24 of Ask the Behavior Doctors. My name is Dr. Jacob Bonet. I'm here in Scottsdale, Arizona. I'm the owner and clinical director of Scottsdale Pediatric Behavioral Services. I want to thank you for joining us today. We have a very special day today. We are talking about potty training. We're going to do a two-part special on potty training. Okay, so the question I got about potty training recently is a very generic question, but very applicable to a lot of people. So it goes, I have a 3-year-old daughter who I want to potty train, but I'm worried about doing it wrong. How should I start the potty training process? How do I know if my daughter's ready or not to potty train? Can I cause harm by doing it wrong? Please help. So again, it's a very common request from parents. They want to know what signs to look for. They want to know what to do. They want to know how to structure it. And they do genuinely want to know if they do it wrong, can they cause harm or make things worse? So I'm going to answer all of those questions today, and I'm going to give you guys a solid kind of plan. Now, I do want to reiterate that you want to look for things and you want to make sure that your child is having healthy bowel movements. You want to make sure that they have a healthy dietary intake, because some of the things I'm going to recommend could cause a disruption if you feel like your child does not have healthy kind of digestive behaviors or healthy eating habits. So before doing anything, definitely consult with your doctor or consult with a behavior specialist when following through on this. So signs that a child is ready to potty train. They're compliant with parents' directions and they're going to go willingly to the bathroom. You shouldn't have to drag your child to the bathroom. If you have to drag them every time, remember, they're probably never going to go on their own. So trying to potty train them when they won't even go on their own to the bathroom seems kind of silly. If you're the one that constantly has to prompt going to the bathroom, well, then that kind of defeats the purpose, because there's going to be lots of moments where your child needs to void that you're not going to be immediately available. So remember, your child needs to be able to go willingly to the restroom on their own without you having to drag them or prompt them to go. They can pull up and take down their own pants and bottoms, and this includes fine motor manipulation of buttons and snaps. So parents, if your child can't easily and willingly and readily take down their pants, pull them back up themselves, if they've got to mess with a bunch of button and snaps or they don't have those fine motor skills to do that, that's something we're going to want to figure out before we start potty training. The third one is they can sit on the toilet for durations up to 5 minutes. I probably, especially for a young kid, don't want to go any more than about 3 minutes, but 5 minutes is definitely the limit. I would want to sit a kid on the toilet. So if your kid can't willingly and compliantly sit on the toilet for that long, they're going to get up. If you're going to constantly have to prompt them to sit down, well then, again, they may not be ready to potty train. So you're probably going to have to work on that skill before we move into potty training. Additional things you want to look for when considering whether it's time to potty train or not. A consistent voiding schedule. So it's really, really nice for potty training purposes if your child has a consistent voiding schedule. If they go regularly in the morning, in the afternoon or night, and then they urinate regularly throughout the day. The reason this consistency is it could help us kind of predict before they're going to void so that we can then get them to the toilet in time. Another thing is it's just healthy to have a consistent voiding schedule. That's a good indicator that the body is healthy and in balance and has good scheduled processes going. Remember, timing cycles and rhythms is a thing that the body really likes. So when a child's on a good cycle and good rhythm with their voiding behaviors, that's a good indicator. Healthy consistency and coloring of their stool and urine. I know that's a little gross to kind of think about, but you want a nice consistent color and softness to stool. You don't want overly soft, you don't want overly hard. Should be solid enough that it kind of comes out in a consistent, log, if you want to say. But it shouldn't be overly hard, shouldn't be overly soft. And again, a nice consistent light brown color is probably going to be best for that. If it's black, that could indicate possible bleeding, blood in the stool, If it's overly light, it could indicate just kind of an imbalance in the digestive system. So pay attention to the consistency and coloring of that. And then the urine, obviously urine should be pretty clear, especially if your child's drinking enough fluids. If it's overly dark or overly discolored, that's definitely going to be a sign. If the child shows an awareness of potty behaviors, so if they can talk about, Mom, I need to go potty, or oh, Mommy, I pottied, or oh, Mommy, look at the kid pottying on the toilet or on the TV, that's definitely a good sign. And then healthy and consistent dietary intake. For a good comprehensive potty training intervention, we are going to have to manipulate temporarily what your child's eating. We're going to have to tremendously increase their intake of food and liquids. And so if your child doesn't have a healthy repertoire, healthy dietary repertoire, doing that could cause some problems in their system, in their internal system. So you want to make sure that when I say healthy dietary repertoire, your child has lots of foods that they like. Your child will eat foods that are conducive to having them poop. Your child likes a lot of different things. Your child willingly eats. You don't have to force them to eat or anything like that. So those are kind of the eating behaviors that we're looking for. Some warning signs to look for that, you know what, maybe something's going on, maybe it's not time to potty train, maybe we need to get this checked out by the doctor. Erratic or inconsistent voiding schedules. If your child seems to have no real consistency to their voiding at all, and it's not really predictable, not really consistent, you may want to check that out. And again, you may have to make dietary modifications or timing modifications to their caloric intake to help consistently make that schedule a little bit more even. But again, if that schedule is very erratic and you can't really predict when your child's going to void, that's definitely going to make potty training a lot more difficult. Pain when toileting. Some children do experience pain, especially when voiding in the toilet. Sometimes small children can have extremely tight sphincter kind of muscles involved in that process, and it can be very painful. Some children just do not like to go to void on the toilet because of that pain. So there's a couple things you could do with that. You want to consult with your doctor. A lot of times parents will use some kind of stool softener, some kind of dietary modification to make the stool a little bit softer so that it comes out easier and it's not as painful for the child. Remember, if your child does experience pain when toileting, obviously their motivation is going to be effective to consistently toilet on their own, and it's probably going to be hard to maintain any kind of motivation to get them to do it consistently. Constipation is a major issue. Look for signs of constipation, look for habits of constipation. Again, if your child's going 2, 3, 4 days without pooping, that's definitely a red flag. Some children can hold it for days at a time. It's unhealthy. Consistent constipation. It can show an imbalance in dietary types of intake. It could show, that there are issues with the digestive system. So maybe your child's not digesting a certain type of food properly. Maybe they have some kind of food allergy or some kind of reactivity to something that they're eating. Constipation, again, is definitely a red flag. So if you're seeing that consistently, it's probably not the right time to start potty training. Erratic or unpredictable voiding accidents. So a lot of parents will report this to me that Johnny just sometimes, he just wets himself, soils himself, and really didn't make sense and wasn't really announced, and there was no predictability, and he just went to the bathroom 5 minutes before. So if your child's having erratic or really unpredictable voiding accidents, you're going to want to maybe obviously monitor their dietary intake. You're going to want to monitor how often that does happen. You're going to see if that ever has, cycles or rhythms to it. You're going to kind of want to see how it's related to maybe environmental stress or environmental contingencies in the environment that might be contributing to that. Again, it could be dietary, could be stress related, could be related to digestive issues, all kinds of things. So again, if they're continuing to have those erratic issues, definitely not a good time to start potty training. Hard or bloody stool. Again, stool can appear pretty dark in color, almost black when there's blood in it. And again, there could be blood in stool for many reasons. So that's something you're going to want to pay attention to. Overly hard stool, again, is problematic. because that shows it's not being digested or passed through the system properly. And again, it can turn into very painful voiding if that stool remains hard for long. Discolored urine, obviously we talked about, can show that maybe there's not enough liquid intake. Maybe your child isn't drinking the right types of things, drinking frequently enough, drinking enough quantity. So definitely something to pay attention to. Frequent diarrhea. Diarrhea can be really hard because if the child consistently has diarrhea, just their awareness of what that feels like, that toileting sensation, can be delayed because diarrhea comes out pretty easily, pretty quickly. So we want their stool certainly to be hard enough that they can prevent it from coming out and they can be aware that they need to go to the potty. And then super picky or restrictive eating, definitely something that is going to be a problem because again, we're going to have to manipulate some caloric and liquid intake at the beginning of the potty training intervention. So if your child is a super duper picky eater or super picky about what they drink or when, and it's going to be a battle to get them to do that, we may want to work on those types of behaviors first before going to potty training. Okay. So parents, that brings us to the end of part 1 of our potty training special today. We want to thank you for joining us. We definitely want to encourage you to join us for part 2 to kind of hear about an intervention, hear about a solid plan that you can do as parents to get your child to potty train. We want to encourage you to submit those questions to us at info@scottsdalepbs.com. We want to thank our photographer, Mr. Philip Carnevale of philipcarnevalephotography.com. And we want to thank you again for joining us here at Scottsdale Pediatric Behavioral Services and Ask the Behavior Doctors.